Fifth disease is a common childhood virus which usually causes a bright red rash on your cheeks. For this reason, fifth disease is sometimes also known as slap cheek disease. It is the fifth most common childhood disease, but can occur at any age. It is caused by the parvovirus B19 and is usually mild and self-limiting. As well as a red rash on your child's cheeks, your child may also experience fever and malaise. The rash may also spread to your child's body and limbs. It is primarily spread through the respiratory tract via coughing and sneezing, and usually resolves on its own within a few weeks. A person infected with fifth disease is only contagious during the early part of the illness. Once symptoms have appeared, the carrier is no longer infectious. Therefore, you do not need to remove your child from school or childcare if they have a red rash or other symptoms of fifth disease. Phase 1 of the virus begins with the classic slap cheek appearance, which starts to fade after 2 to 4 days. This will then lead to phase 2, which creates a mottled patterned rash that merges together. This will occur 1 to 4 days after phase 1. The last phase, phase 3, is characterized by frequent clearing and reoccurring of the rash for weeks or sometimes months. After initially contracting the virus, the phase can be provoked by certain stimuli, such as exercise, stress, and irritation of the skin. Although fifth disease is usually mild, it can be harmful to unborn babies. Therefore, pregnant women should be cautious in areas where the bacteria can spread rapidly, such as childcare centres and health centres. There is also research which suggests a link between parvovirus B19 and neurological deficits. However, further research is needed into this. Diagnosis of parvovirus B19 associated with neurological deficits should be determined solely by further investigations. For example, investigating for anti-B19 antibodies and B19 DNA in serum or cerebrospinal fluid. This is a worst case scenario and is not usually outcome of contracting the virus.
As fifth disease is usually mild and resolves on its own without complications, it is unlikely that expensive treatments will be needed. You may wish to see a pharmacist who can advise on medications to reduce your child's symptoms. These medications will not cure the virus, but will relieve symptoms such as fever and headaches. Medications that can provide this relief include antihistamines and analgesics. It is best to consult your pharmacist, who will be the best health professional to guide you in finding symptomatic relief for your child. Buying symptom-relieving medications is one of the most expensive approaches to treating a typical case of fifth disease. The least expensive approach would be to leave the virus to run its course without medication, as it will usually clear up on its own. You can also use baths to soak the skin and relieve itching. Adding oatmeal to the bath can also be beneficial and is an item that is usually found in most people's pantries. It is best to treat the symptoms that occur in a way that is necessary and appropriate, from leaving the symptoms alone to buying medication at a pharmacy. If you notice any unusual or atypical symptoms in your child, it is best to consult their doctor, who will be able to advise on the most appropriate course of action. This may include further investigations or a referral to a specialist. To conclude, fifth disease is a common childhood disease that is usually mild and will go away on its own. You cannot treat the virus, but if you wish to use medications to relieve your child's symptoms, visit your pharmacist, who will be able to assist in advising you on appropriate medications. It is usually nothing to worry about, as the prognosis in typical childhood cases is excellent, and it will usually resolve on its own within a few weeks. However, if you have concerns or your child is experiencing unusual symptoms, it is best to consult your doctor for further advice.